Hello, my name is Dr. Joe Childs. Welcome to our office. Thank you for coming in for your fibromyalgia consultation. Today what I'd like to do is have you watch this short video where I will discuss exactly what we do to help patients overcome chronic pain syndromes such as fibromyalgia. We're going to talk to you today about the functional, neurologic, and functional medicine approach to helping patients with chronic pain and fibromyalgia without the use of drugs or medications. So we're going to talk to you today about exactly what we do. And then after this short video, we will be coming in, either Dr. Dara or myself will come in and we will sit down and talk to you about your individual concerns with fibromyalgia. We'll have your consultation. We'll try to understand exactly what you're going through. Every patient with fibromyalgia is completely different. They all have some common types of symptoms, but how they developed the problem, what they've been through, how it's affecting their life is completely different. So we'd like to sit down and talk to you after you watch this video. This video will help you understand more about what we do. So before we get talking about fibromyalgia, before I talk about it, what I'd like to do is tell you a little bit about myself and some of my qualifications. I'm a board-certified chiropractic neurologist. I've been in practice here in Downingtown for 18 years. We've been helping patients with chronic pain syndromes and chronic neurological conditions for all that time. Most people that have been to a chiropractor are not aware of the fact that you can become specialized in chiropractic, just like in medicine. And I became specialized in what's known as chiropractic neurology, or what's known as functional neurology. Functional neurology is drugless neurology. It's treating neurological-based conditions without the use of drugs and surgery. Now, most people with fibromyalgia have muscle pain and muscle aches and things of that nature, so they tend to think that the problem is with their muscles. Fibromyalgia is not really a muscle problem. Fibromyalgia is mainly a neurological, brain-based problem that also has some components of issues with your immune system and how your metabolic or internal physiology is functioning from a blood work perspective. So, chiropractic neurology is a postgraduate education in the field of neuroscience. So after chiropractic school, which is 8 years, 4 years of undergraduate and 4 years of chiropractic school, you can specialize. And the specialization takes about another 3.5 years, and then you become a board-certified chiropractic neurologist. You have to take your board. Within the functional neurology program, you can then further have fellowships, which I have a fellowship in minor traumatic brain injury and concussion, which is treating patients with head injuries and brain traumas, strokes, things of that nature without the use of medications. And then I'm also trained in vestibular rehabilitation, which is rehab and drug-free care for patients with vertigo and dizziness and things of that nature. And then there's another fellowship I have, which is in childhood neurodevelopmental care. So in our office, we don't just see adults, we see children, and we see children with various neurodevelopmental issues like ADHD and autism and OCD and things of that nature. We have a lot of training, and I say we, Dr. Dara and myself, we've been in practice 18 years again together, and we are both trained in functional nutrition, or what's considered functional medicine, and analyzing blood chemistry and helping people with nutrition instead of medications. We also have training in spinal decompression. Spinal decompression care is helping patients with herniated and bulging discs using a technique called spinal decompression. And prior to me having all of this training, I went to Penn State University and I have a degree in exercise physiology, which I use that all the time in practice, my training in that. So that's a little bit about me, and what I'd like to do is let's talk a little bit about fibromyalgia. There's been a study in fibromyalgia, and what they found is the average fibromyalgia patient has tried on average 12 different medications in an attempt to find relief. They've been to 10 different doctors on average, and they've gone 10 years prior to getting the diagnosis of fibromyalgia. So most patients with fibromyalgia have been through the ringer. They have been everywhere. They usually start off with their primary doctor, and then their primary doctor gives them some anti-inflammatories, and then after that they get sent to a rheumatologist, and then they may see a neurologist, and then they go to all these different special clinics, and most of them are taking quite a bit of medication. Again, on average 12 different medications is typical. what you're going to learn today is you're going to learn what fibromyalgia is. I already told you it's a neurological problem with metabolic or immunological issues. What causes fibromyalgia? We're going to talk about that, and we're going to talk about what can be done to restore your health by addressing the root cause. We want to look for the root cause. We don't want to just give you medications to hide and mask the symptoms. We want to find out why it is that you have this chronic pain issue that's affecting your life, that you're not able to, you don't sleep well, you've got chronic pain, you can't even touch your back, or you sit on a chair and it aches, and things of that nature, anything that puts pressure on you. You've got, it's normally patients with fibromyalgia, their life is in the pits because they have chronic pain every single day of their life, and normally when they go to the doctor they can't find anything wrong with them typically, so most people really look at them and say, why do you feel the way you feel? Just get up and do these things. But what you're going to learn is that fibromyalgia is real. Fibromyalgia is not in your head. You may have heard people say that to you, oh, it's all in your head, the doctor said there's nothing wrong with you. Now, fibromyalgia is in your head, it's in your brain. Okay, neurologically, it's a neurological condition, but it is a real condition, so it's not in your head the way people may say that to you. It's a true problem, and it is caused by your nerve fibers becoming very, very pain sensitive, and we'll talk about why that is. The other thing is fibromyalgia is reversible. Most people, when they go see their doctor for fibromyalgia or chronic pain, the doctor will say, well, you're going to have to learn to live with it. Right? So that's not true. But here's the thing, it's not reversible with medications. You can't reverse it with medications because medications are just masking the symptoms. One of the biggest, most common medications that we see given for fibromyalgia, and you see commercials every single, you sit down and watch TV at night, and you're going to see a Lyrica commercial. It's a really heavily prescribed medication. Lyrica, Neurontin, gabapentin. These are anti-convulsive medications. They are anti-seizure medications. They were never really created for chronic pain. They were created for people with seizures. Seizures are an overfiring brain. Parts of your brain fire spontaneously, and these medications come in and they shut down your brain from firing too much. But you want your brain to fire. You want your brain to be active. It's essential. We see people as they get older, they develop fibrofog or Alzheimer's, pre-Alzheimer's, early Alzheimer's, these things here, and that's a brain that doesn't fire so good. So you don't want to take a medication that shuts down your brain. And then Lyrica has a lot of side effects. Here's just a list of them. Suicidal thoughts, because it's affecting your brain. It's shutting down your brain, and so it's affecting you. It's creating some negativity in your brain. Swelling of your hands, feet, and ankles, serious muscle problems, dizziness, skin rash and blistering, constipation, bruising, dry mouth. I would say almost every patient that comes in here that is on Lyrica will tell me they have dry mouth, and they also can have hives and itching. It affects your neurophysiology negatively. This is a study that says Neurontin and Lyrica are highly toxic to new brain synapses. So what are synapses? Synapses are when one neuron or one nerve cell talks to another nerve cell where they connect, and your brain is constantly creating new synapses. Even when we're in our 60s and 70s and 80s, our brain is constantly remodeling. When we learn something new, you read a book, you create new synapses. You learn a new task, you go out and you learn, let's say you pick up a golfing, or you learn how to knit or crochet or something like that, your brain is constantly improving and changing itself. But because Lyrica and Neurontin shut down your brain's ability to fire and function, because they were used for seizures, it's also good for reducing pain, because if you shut down your brain's ability to perceive pain, you don't feel as much pain, but it has a negative effect of shutting down the ability of your brain to create new synapses. So your brain is not improving, and your brain should improve as you age because you're constantly learning new things. Okay, so that's a bad thing. Okay, now Einstein once said the definition of insanity is doing the same thing over and over and again and expecting a different result. So patients will come in to me and they'll say they've had fibromyalgia for 18 years, and I'll look at the medications that they're taking, and it's usually Lyrica, it's usually Cymbalta, it's usually some type of anti-inflammatory, sometimes it's Oxycontin or some of these more addictive types of morphine, types of medications and things of that nature, opiates. And so we see this all the time, and then I say, well, how are you feeling? I feel terrible. I said, are the medications working? I don't know. I've been taking them so long. So you're doing the same thing. How long have you been doing it? You've been doing it over and over again, and there's no change, nothing. And I said, does that make sense to you? Or do you feel like you're getting at the root cause of the problem? And they just told me, well, my medical doctor just says keep taking these medications. There's nothing else that they can do. This is basically it. You're just going to have to learn to live with it. Just keep taking these medications. Well, what about the side effects of the medication? The opioids are creating constipation and this, that, and the other. So Einstein said that's insane. We should be looking for the root cause of the problem. So how are we different? We want to improve the way you feel by restoring your health and optimizing your metabolic and neurostructural function. This is accomplished by using evidence-based, drug-free nutritional protocols, as well as specific neurological and structural therapies. We want to get at the root cause of the problem. Medications are used to cover up the fibromyalgia symptoms, which are the warning signs that your nervous system and body are not functioning properly. They are not intended to reverse the dysfunction. The medications you're taking are not intended to fix the cause of the problem. They're just intended to turn off the symptoms. Now, I'm not completely against medications. I mean, if you are in severe pain and your life is being affected dramatically and terribly, you may need to take some medications. Where I have a problem is the people that just continue to take the medications, and they look nowhere for the cause. Most medical doctors are not trained in nutrition. They're not trained in functional neurology. They're not trained in looking at the brain from a neurological-based, drug-free approach. If you have a negative brain MRI, which most people that go get imaging for their brain and what have you when they have these chronic things, they say, you know what, there's nothing we can do. And you just keep taking the medications over and over and over again. As we help patients, as we get them better and as we get them feeling better, what will happen is we will have them go back to their medical doctor to start to take less and less of these medications. We can't tell you to stop taking your medications. So when you come in and you do, let's say, our program, we're not going to say, get off the medications, you're now doing it the natural way. No. What we're going to do is we're going to try to restore your health and improve your function. And as we do that, as you start feeling better, we're going to send you back to your medical doctor to start weaning you off of some of these medications that you've become almost addicted to. Okay? So we treat fibromyalgia metabolically, which is nutritionally, based on blood work, and neurologically and structurally. So there is a drug-free solution. We're going to talk about that today. So we're going to look at you metabolically, neurologically, and structurally to help your fibromyalgia. We leave no stone unturned in finding out why you have the problem. Again, we're looking for cause here. Okay? Functional neurology, again, change your brain, change your life. We're going to look at overall brain function, determine what areas are causing your migraines or causing your fibromyalgia. One of the things that we see with patients with fibromyalgia is they usually have a lot of headaches as well. We see migraine patients and we see fibromyalgia patients as well. So we want to look at your brain. So we want to find out which areas of your brain are causing the problem. The current research on chronic pain and fibromyalgia points to what is known as autonomic nervous system dysfunction. The autonomic nervous system is the part of your nervous system that controls all of your internal function. It controls your gland function, but as far as, and it controls blood flow to your head and all your different body parts, but as far as fibromyalgia is concerned, the autonomic function controls the sympathetic and the parasympathetic balance. Patients with fibromyalgia are out of balance or hypersympathetically functioning. So the sympathetic nervous system is the fight-or-flighter part of your nervous system. It's the aroused part of your nervous system. It's the part of the nervous system that's firing in high gear when you're stressed. It will be very much connected to your pain portions of your nervous system. So the sympathetic and the pain portion of your nervous systems are connected. So if you have a high-firing sympathetic nervous system, you're going to have high levels of pain. The control center for this is in the brainstem. So we want to look at how you function neurologically. Now, everything that we teach you here, or everything we go over here, is not something that we pulled out of a hat and made up on our own. It's not some type of chiropractic lingo or something like that. This is true, functional, evidence-based, meaning researched information. This is from the Journal of Clinical Rheumatology. The sympathetic nervous system dysfunction in fibromyalgia, chronic fatigue, and irritable bowel syndrome. Patients with fibromyalgia tend to have problems with their bowels. And interstitial cystitis, which is a bladder problem. A review of case control studies. So the sympathetic dysfunction is completely understood. The difference is they want to try to change the sympathetic dysfunction using a drug. We have other means of changing that. There is a link. The functional connectivity of this primary somatosensory cortex, which is your brain, is altered by sustained pain and is associated with clinical autonomic dysfunction, meaning the part of your brain that controls blood flow and pain is not working well. It's in overdrive. Fibromyalgia is associated with decreased connectivity between pain areas and the part of your brain that inhibits pain and controls motion and movement and sense. So here's the brain stem. Okay, now just so you understand what we're looking at here, this is your brain. Okay, it's got a right side, a left side, and then underneath here is your brain is basically a ball on a stick, and this stick underneath here is your brain stem, and that connects to your spinal cord. You have the upper brain stem, which is called the mesencephalon, and the lower, which is the pons and the medulla. So we'll just call it lower and upper. Upper brain stem is the sympathetic nervous system. In fibromyalgia patients, this part of the brain starts to fire way too fast, and the lower part of the brainstem starts to fire way too slow. This is the cerebellum. The cerebellum controls balance and coordinated movement, but it's highly connected to the lower brainstem. Okay, so that's kind of some anatomy. We're not going to make you a neuroscientist, but we want you to understand this as good as we can. So normal brain function is you have the, well, this is kind of reversed. We'll look at it from the back. You have the left brain and the right brain. And then you have the cerebellum, which is underneath here, and then you have the mesencephalon and the pons. So the cerebellum and the brain really fire a lot of information into this pons and this medulla, which controls the parasympathetic part of your nervous system, controls blood flow to your gut. It's more relaxing. It's going to reduce cortical or it's going to reduce adrenal stress. People that have adrenal glands that are firing too fast, it's going to calm all that down. It increases blood flow to your internal function, and it's going to keep your heart rate low. It also inhibits pain. The lower brainstem keeps the upper brainstem in check. If the lower brainstem starts to function bad because these areas are not working so good, you start having this area that starts getting wound up. It's kind of like a bad teenager. If it's not maintained or inhibited by these guys that are in control of it, it starts to wind up and creates an overfiring brainstem. When you get this overfiring upper brainstem, that's when you start having brain imbalance, resulting in an overactive upper brainstem, creates chronic pain and chronic fatigue, headaches and light sensitivity, blurred vision, increased sweating because the sympathetics control sweating, difficulty falling asleep. Most patients with fibromyalgia have a big trouble falling asleep. Heart palpitations. They feel like their heart's racing. Irritable bowel syndrome, urinary tract infections, high blood pressure, fibrofog. Now you can take a drug like Lyrica that's going to shut all this down so you don't feel that, but that's not good for your brain long term. Does that make sense? It's not good for your brain long term. The relationship between sympathetic activity and pain intensity in fibromyalgia. High firing sympathetics, high intense pain. That's a study. For those of you that like neurology and like to understand how all this happens, I'm not going to spend a lot of time, but I will during the consultation if you want to understand it more. But an overfiring upper brainstem will fire down into the spinal cord to the sympathetic areas, which is that high firing pain types of centers. That's going to affect your adrenal glands and make them overfire too fast, which will affect C pain fibers, which are your pain fibers throughout your body, and bam, you have chronic pain. So what happens is your pain becomes, the central pain system becomes central pain sensitization, meaning your pain nerves become activated everywhere. So even nerves that are for touch. So if you feel a massage or something like that, or somebody puts touch onto you, normally that feels good when somebody touches your back, or you get somebody massages your back. But in fibromyalgia patients, what happens is these free nerve endings, which usually transmit good feelings of touch and pressure and things like that, they start to act like free nerve endings. And this is why just touching your skin or touching your body in fibromyalgia, a fibromyalgia patient, is so bad. Now, some patients can handle that if they're just in the beginnings of fibromyalgia. But if fibromyalgia has gotten to a point of being incredibly chronic, then what can happen is, these are really what we call sensitized fibromyalgia patients, and we have to be very gentle with these types of people. Overfiring upper brainstem will affect the blood vessels in your brain and it can create migraines. Migraines are something that we see very commonly with fibromyalgia patients. Overfiring upper brainstem will create insomnia and fatigue. You'll have trouble falling asleep, staying asleep, things of that nature. Okay? And then emotional stress is going to affect those adrenal glands. The adrenal glands are very important in fibromyalgia patients, and that can create this foggy feeling. People will say, I feel just foggy all the time. We'll talk about that. Your GI tract has a lot to do with that as well. And overfiring mesencephalon will create too much sympathetic activity, which will then affect reduction in what's called the vagus nerve. The vagus nerve controls all of your internal function, so you can start to have IBS, constipation, diarrhea, things of that nature. And you can also, some people will start to have more frequent urinary tract infections. And we get a lot of light sensitivity with fibromyalgia patients because the upper brainstem controls the diameter of the pupil. You'll have a larger pupil, and then you'll have light sensitivity and things like that. So people say, I ache all the time. I have sunglasses on all the time, constantly I feel bloated all the time. These are typical symptoms of fibromyalgia patients. It doesn't get better on itself. This is a study. They found out that the longer that you have fibromyalgia, the more and faster your brain dies off. That's pretty scary to think about, but the Journal of Neuroscience reports that the longer an individual had fibromyalgia, the greater the gray matter loss, with each year of fibromyalgia being equivalent to 9.5 is the loss in normal aging. So fibromyalgia ages your brain quickly. Once we start getting this sensitization, areas of your brain stop functioning as well, it's very bad. But the problem is then we start throwing on medications which actually cause our brain to even function less good. It makes you not feel the pain, but now your brain's going downhill quicker. You don't want your brain to go downhill because your brain is what creates you. Bad brain, bad you. So it's very important to understand that. How does this happen to the brain? Well, how do people get fibromyalgia? People will always say, well, some type of physical, mental, or emotional stress brought it on. I was doing pretty good until I fell down the stairs, and I've been a mess ever since. Or I've been pretty good until I had a baby, my 5th baby. Ever since then, I've been a mess. Well, that's a physical stress on a woman. I had emotional stress. I had a loss in the family, and it just really rocked me emotionally. And ever since then, I've been in this state. Metabolic stress, meaning maybe I had to overcome cancer. Maybe I have problems nutrition. Maybe I developed diabetes. And so these things will bring about fibromyalgia because it affects the brain functions and the nervous system functions. Now, the difference between us as functional neurologists and a conventional medical neurologist, a medical neurologist is typically focused on the diagnosis of structural pathology and utilizes medications or drugs or surgeries to help it. So, you go get a brain MRI. If you don't have a tumor or a stroke or something that they can see or cut out or something like that, then you just have a physiological problem that they're going to try to affect with medications. We view the nervous system as a moldable, changeable entity. Your brain can change. Your brain is not stuck in this terrible, painful situation. We can affect the brain through virtually unlimited types of environmental stimulus and specific therapies. This is the concept of the brain being able to change its function. It's called neuroplasticity. Now, to improve your nervous system, your brain's going to require 2 things to function properly. It's going to require fuel, and it's going to require activation. Fuel is in the form of the nutrition that we give you. So we want to look and see, do you have any vitamin deficiencies? Do you have inflammation? Is your food being used well? Do you have diabetes or hypoglycemia? Do you have prediabetes? Do you have insulin resistance? Do you have thyroid problems? That's the fuel part of your brain. And then oxygen. Your brain needs oxygen. So we treat patients, we put our patients on oxygen. We put them on about 95% oxygen when they're doing their therapies, because oxygen increases the good areas of the brain firing, and it's very interesting, but it slows down that upper part of the brainstem that we don't want firing too fast. And then we're going to do activation. We're going to do brain exercises. We're going to stimulate the weak areas. We're going to do some things to calm down the hyper-firing bad areas. And that creates plastic changes in the brain. So again, your brain is moldable. It can change. If we stimulate it, it will improve and change. So we want to make your brain better at inhibiting pain, okay? And we want to do that without medications. And it's completely possible. Just Google the word neuroplasticity when you get home, and you'll see about 3,000 articles on that. It's the the hot term in neuroscience today. We combine the latest research-packed neurological examinations and advanced neurological testing for fibromyalgia patients. So when you come in, if we go forward with step 2, we'll call it, which is our examination procedures, we're going to do a very, very thorough neurological examination. We like to look at eye movements to find out which area of your brain is being affected, because eye movements are the only physiological function that involves every area of the brain. So we're going to look at that. We're going to find out which areas of your brain are working good, which areas are working bad, so we can develop a strategy to improve those areas. So this is the testing that we do. We use these goggles. It's called a V&G test. Now, what I want you to understand is, we have these things called pain triggers. And we have this situation where patients with fibromyalgia pretty much never feel good, but they're going to have times when they really feel bad. Most fibromyalgia patients call them fibro flare-ups. And what fibro flare-ups are times when your threshold is so low and your triggers are so high. Triggers can be foods that you're sensitive to, it could be changes in the weather, it could be stress, things like that. So it's like you have this big bucket, right? And it gets filled up with all these triggers that will trigger you to have this fibro flare-up. Your threshold, if your threshold's really high, you never have a flare-up, right? Because your nervous system's working so good. But if your nervous system's not working good and it's sensitized, the threshold's really low, and all it takes is a few triggers and bam. So like an overflowing cup, when your pain triggers exceed your neurological threshold, you're going to have a fibro flare-up. What we want to do is we want to use breakthrough drug-free neurological therapies to balance and improve your brain function and increase your neurological threshold to having flare-ups. Higher threshold, better neurological function, less chance of having these flare-ups and pain syndromes. So we're going to do things like oxygen therapy. We talked about how important oxygen therapy is because it helps the brain. So we're going to put you on oxygen. Most of the exercises and stimulations that we do, we're going to have you on oxygen, which provides fuel. It fires the brain and improves the brain function, but it decreases the part of the brain function that we don't want to be too high, which is the mesencephalon. We're going to do specific eye exercises that improve brain areas associated with your fibromyalgia. We'll do something called somatosensory evoked potentials. We do them on different areas of the ears, we do them on the tongue. What they do is they stimulate that lower brainstem, because these nerves go right into that lower brainstem, which will increase the firing of the parasympathetic centers. We also use something called vagal stimulation. The vagus nerve is the largest nerve. The parasympathetic nerve comes off your brainstem. Google vagal stimulation. Vagal stimulation is incredible for depression, chronic pain syndromes. We use that in our office. You sit there, it's a very relaxed feeling. Most people start to just get this real relaxed feeling while we do it. We'll have that while they're on oxygen therapy. We may do vibration therapy. We may do some inner ear stimulation, which will stimulate the lower brainstem. Proprioceptive stimulation, which is using the joints. We'll do that in patients that are not too sensitized. We can use joint stimulation. Vestibular, again, is inner ear stimulation. We'll work on your balance. A lot of patients with fibromyalgia have very bad balance. Muscle retraining, interactive metronome, which is a program that we use on the computer that trains the brain. We'll do some corrective chiropractic care and spinal decompression therapy. These are the concentrators that we use. It delivers 95% oxygen, and it's going to activate your brain. The normal oxygen that's in the atmosphere is about 20%. So this concentrator, so it's not really a tank of oxygen that we use, it's a concentrator that allows you to breathe it in, and we use a cannula straight on your nose, and you'll breathe that in while you're in the office. Now, some patients have fibromyalgia due to structural problems in their spine. Lots of fibromyalgia patients will have herniated discs in their neck or in their lower back. They'll have arthritis in their neck or their lower back. Maybe they've been to the orthopedist. Maybe they've had previous spinal surgeries. How much pain you have is the sum of how good your brain is at inhibiting the pain. So if you have a very good brain functioning that's very balanced and things are not out of balance with the sympathetic and parasympathetic, then your brain is going to be a very good pain inhibitor. And then coming up from your body is any damage in your body. So if you have tissue damage in your spine or in your muscles or something like that, that's going to fire pain up. But if the brain is really good, that pain is going to become diminished and you won't perceive it. But if you have bad brain function and bad spinal health, like you have arthritic joints in your spine, degenerative discs, bulging discs, then now these areas are very much inflamed. There's tissue damage, which is creating pain coming up, If you have a very bad brain that doesn't inhibit these things, and then your quotient of pain is going to be very high. So we want to help people. Now, we may not do chiropractic adjustments. I know, some of you may have been to a chiropractor. Maybe the chiropractic adjustments that are done a little too forcefully or something like that make you flare up. We completely find out where you are on the central pain sensitization, and if you're a very sensitized patient, then we can't use chiropractic. If you're a very unsensitized fibromyalgia patient, or sort of a beginner in fibromyalgia, then maybe we can do some chiropractic. So if we're going to do anything, we may just use very light instrument, or we may use vibration, or we may just use joint mobilization, but it's nothing that's forceful. And it's all depending upon where you rank on the central pain sensitization as far as being a patient. How sensitized are you? So we may not do any chiropractic adjustment. We may only do brain care. But the spine is very important. So this is a normal curve that you should have in your spine. One thing that we find is that a lot of patients, they don't have this really good posture anymore, especially with fibromyalgia. They start to have this forward head posture where the alignment becomes very bad in their spine. And we see this, people on Facebook all day, looking at computers all day. This creates a lot of tension in these muscles. And when you have incredible amounts of tension, because if your head goes forward, it's kind of like holding a bowling ball, right? And if my head's forward, my head's way out here, these muscles are going to be very tense and taut. So if you're fibromyalgia patients with a lot of chronic upper back and neck pain, a lot of it could be very much postural. And if their brain's not working good, then it's going to be amplified, the pain syndrome. So this is a pre-X-ray. This is somebody with a forward head posture, right? Forward 52 millimeters. This is their head. This is their body. This is where they should be. This is where they are. And they have a lot of arthritis in their neck. After our corrective care, this is what we did. We put the curve back in their neck through care. And that can help dramatically with this forward head carriage. So structural care is key. Patients that have degenerative discs, we like to use a therapy called decompression therapy. It's very light mechanical traction to take pressure off of these discs that are compressed in the back. And what we'll do is that'll create a nice gentle stretch. We also have the patient on oxygen therapy, so they're breathing oxygen. So the stretch is activation, takes pressure off the joints, and we provide that with oxygen. A lot of our fibromyalgia patients like it. Most of the time they fall asleep because it's just a very gentle pull on the spine, which takes pressure off of these arthritic joints. This is especially needed for our fibromyalgia patients that not only have neurological misfirings, but they have very poor degenerative spinal joints in their which is adding to the problem. This is a machine called Active Therapeutic Movement. We kind of lightly strap people in here, and they can do exercises. So let's say you're a patient that every time you bend this way, you've got chronic pain. And what we do is we say, okay, let's brace your core, and then we bend you this way, and the pain goes away. So we'll put you in there, we'll brace you, and then you'll be able to move into that position without any pain. And what that'll do is it'll tell the brain, you know what, you got to calm down this painful mechanism that you've created for this range of motion. And patients love this because it can be an immediate relief of pain that's caused when you do a certain motion. Now, we've talked about the neurology. We've talked about neurological based care and how important that is. Absolutely essential because fibromyalgia is basically a neurological condition. We've talked a little bit about the structural care and some fibromyalgia patients that will need structural care. We've talked about the fact that sometimes we can't do structural care on sensitized patients, highly sensitized patients, and then we're only going to do neurological based care until they start to function better, and then we move into very, very gentle structural care. This is the missing link, is the metabolic care. Remember the three things that we do. So we're going to do specific individualized nutritional recommendations based on blood work and special testing. So we use functional medicine to help people's blood chemistry. So we're going to, what we'll find out is the patients will come in here and a lot of times they'll say, well, doc, I've already been to my medical doctor. He says my blood work is normal. Sometimes people will say that, or a lot of times people will say that, but here's the thing. We want to look at the ranges of your blood work. We want to look at your actual findings for each test, and we want to say, okay, are they normal or are they just in the reference range? The reference range that you see, that comes from, most people don't understand this, that reference range you see is the average of everybody giving blood. Now, who gives blood? Healthy people or unhealthy people? Unhealthy people give blood. So you don't want to be the average of the unhealthy. You want to be the average of the healthy. And so what we like to look at is what's considered functional ranges. Functional ranges are studied of anybody that doesn't have disease, they don't have symptoms, and we look at their blood work. What's their average? So we want you to be the average of that. The other thing is most of the time medical doctors, they're only going to run a certain amount of tests very much based on what the insurance will pay for or something like that. So they don't run some special tests that are necessary to finding out the root cause of your fibromyalgia. Typically they're not looking for the cause because they're just trying to figure out which chemical cocktail they can give you to make you not feel the pain or to reduce the pain or what have you. So we're going to run a thyroid test. Most doctors are only going to run TSH, thyroid stimulating hormone, and maybe a T4. But we're going to find out, do you have thyroid antibodies? Is your immune system attacking your thyroid, which means it could be attacking your body? We're going to run all these different tests because we want to find out exactly what your thyroid profile is. Patients with thyroid problems or patients with fibromyalgia problems, typically there's a very huge correlation between thyroid problems and fibromyalgia problems from the metabolic perspective. Big thing we want to look at is inflammation. Patients with fibromyalgia usually have chronic inflammation. Here's the thing, it's usually not one problem that's causing you to have the problem, that's causing you to have your chronic pain. It's neurological misfiring, it's poor spinal structure, it's chronic inflammation. All those things are working together to create this problem that you have. Inflammation is like a fire going on inside your body, and it creates a lot of problems. It can create systemic full body inflammation. What causes inflammation? Food sensitivities, anti-inflammatory foods. We want to put you on an anti-inflammatory diet. Your GI tract, your gut, if your gut is inflamed, your body and your brain will be inflamed. So we want to find out, do you have hidden gut infections? Do you have a leaky gut? A lot of people take in way too many bad fats in their diet. So this omega-3 to omega-6 ratios. High insulin. We eat too much carbohydrates. We have pre-diabetic issues. Insulin resistance. If you're a patient that has trouble losing weight, that sometimes is a big idea because you may have high insulin. Hormone imbalances, trouble with your cortisol, estrogen balance, things of that nature. These all can create inflammation and inflames your nervous system. We sometimes will run special testing to find out, do you have a leaky gut, which is Cyrex Array 2. We'll run something called Cyrex Array 3 that will let us know if you are sensitive to foods like gluten, like dairy, like soy, like certain grains, things of that nature. We want to look at your gut, and we want to also look at your adrenal or your stress glands. Let's talk a little bit about leaky gut. This is a very hot topic today in healthcare, especially preventative healthcare. I think Dr. Oz just did a full show on it. In fact, on our website, there's a show on leaky gut and how people can be helped by improving the leaky gut. Let's just do a quick explanation of why this is important. Your gut provides, your intestinal walls provide a separation from outside of your body and inside your body. When you eat food and it's in your gut, it's not really inside your body until it becomes absorbed through the gut wall into the bloodstream. Now it's in your body if it's in the bloodstream, right? Out, in. So your gut, like a screen door, is supposed to provide a separation between the inside of your digestive tract and the inside of your bloodstream. It doesn't let things in unless they're fully digested. So there should be tight junctions between the cells of your gut. So when you eat a protein, that protein needs to be digested down to a peptide, which needs to be digested down to an amino acid. Amino acids are tiny, and they are the only thing that should slide through here into your bloodstream. And if they get into your bloodstream, they go nourish your body wherever they need to be. Okay? Now, white blood cells are attracted to proteins, but they're not attracted to, white blood cells are the immune system. They're attracted to proteins, but they're not attracted to amino acids. So if you have a leaky gut, microscopically you have this breakdown of your gut, then now proteins can get through, bacteria can get through, viral aspects can get through, yeast can get through and into the bloodstream. Now the immune system starts to react to those things. And when they react to those things, it creates an inflammatory response. That's one of the ways you develop autoimmunity. Now, a lot of people will say, well, Doc, I just had a colonoscopy, and they found that one polyp, got rid of that, and they said they didn't see anything else wrong. You cannot see leaky gut with a colonoscopy. It's not like it's Swiss cheese, okay? It's microscopic leakiness. You can only test that with a test that's specific to test antibodies to your gut. There's 3 types of leaky gut. Each of them has a different type of fix, okay? How do you know you have a leaky gut? Well, first off, you can have no digestive complaints at all and have a leaky gut, okay? A leaky gut can be causing your chronic pain. You may say, Doc, I don't have any IBS. I feel great in my gut, but I have all this pain and I've got, these types of issues. Some people with leaky gut will have bloating, chronic pain, brain fog, anxiety, and depression. And we do see a lot of numbness and tingling issues because the gut, when that's not working good, you can start to have neuropathy as well. Causes of leaky gut, the typical American diet: stress, alcohol consumption, parasites in your gut, poor brain function. If your brain is not working good, then the parasympathetic nervous system is not working good, and then the parasympathetic nervous system, the vagus nerve that controls your gut, is not going to create tone in those cells in your gut, and then you develop a leaky gut. So a bad brain can create a bad gut, which can create a leaky gut, which creates inflammation, which then can create an inflamed brain. That's called a vicious cycle. And what happens is patients with fibromyalgia have multiple vicious cycles going on, and the vicious cycles need to be affected. If we don't fix the vicious cycles, then you're going to have it's going to get worse and worse and worse. So we do want to test your GI tract. We want to test a stool kit. A stool kit will let us know, do you have any bacteria? Do you have any yeast or candida? Do you have any parasites? You'll be surprised how many people have parasites. You can get parasites from eating out. You can get parasites from drinking bad water. You can get parasites from animals, different things of that nature. From having a dog, right? Autoimmunity. Fibromyalgia can be caused by autoimmunity. Autoimmunity means your immune system's attacking your body. We want to find out, is your immune system attacking your body? If you have Hashimoto's, that means your immune system is attacking your thyroid. If your immune system is attacking your thyroid, it can be attacking your brain and your nervous system as well. So a lot of people are walking around and they have autoimmunity that has not yet turned into an autoimmune disease, such as rheumatoid arthritis, lupus, Sjogren's, and things like that. So a lot of people will say, Doc, no, I don't have autoimmunity. My doctor tested me. I don't have rheumatoid arthritis. I don't have lupus. I don't have any of these. I don't have MS. The key word is you don't have that yet. So doctors are checking, do you have a really bad autoimmune disease? But most people have pre-autoimmune disease or inflammatory aspects going on that are eventually down the road going to cause these problems. And this, again, we study everything here. Cytokine and immune system abnormalities in fibromyalgia and other central sensitivity syndromes. We're not making any of this stuff up. This is in science. You can go home and Google this stuff. So we're going to do sensitivity testing, find out which foods you're sensitive to. And then the adrenals. We can do an adrenal stress index. It'll let us know, is your cortisol high? Is your cortisol low? Is your brain affecting your cortisol? These types of things. And it gives us this printout, which will let us know, you should have, your cortisol rhythm should be along here. It should be high in the morning and low at night. So this patient was low in the morning and high at night. So now they're not sleeping because of that. So this is a abnormal circadian cortisol profile or rhythm. This patient was a 51-year-old female, 3 years of chronic pain, foot pain, burning, night sweats, and cold hands and feet, and irritable and angry all the time. So this is the cortisol. So the adrenal glands are very important. We usually like to test these. The brain really controls these adrenal glands, so they can be off due to the brain dysfunction. So a lot of people will say, well, Doc, I'm not under stress, but we don't necessarily understand all the things that can cause stress. Injuries can cause stress, poor posture, lack of exercise, blood sugar issues, caffeine, poor food choices, finances, relationships, work stress. That all can create adrenal stress and adversely affect your adrenal stress test. How many of you had, or have you, I've done this, I do this workshop in front of multiple people, but have you had these tests? Has the doctor looked at your adrenal glands? Have they looked at your brain? Have they looked at your eye movements? Have they looked at your GI tract? Do you have a leaky gut? Do you have parasites in your gut? Have they looked at all these things? See, we want to look outside the box. Inside the box that you're currently doing, most likely, is you just go to your doctor and they just give you medications. And as the medications don't work, you get more and more medications or you get stronger medications. even up to the things like the opioids and things of that nature. Most people have not had these tests because most medical doctors are not trained in this. Not to say that they're not trained in some really good things, but they're not trained in this type of care. We have incredible results in our patients because we do this unique brain-based metabolic care, but we're only going to accept patients we think we can help. If we don't think we can help you, if we can't find a neurologic, metabolic, or structural reason for your fibromyalgia, then we can't help you. So we only accept patients in our office that we think we can help. That's why we have such great results. We have dramatic results. We can dramatically reduce or eliminate fibromyalgia symptoms. We do it all the time. We've been doing it for the last 18 years. So here is what's going to happen. I'm going to come in, or Dr. Durr will come in here in just a bit. We're going to sit down. I want to understand everything about your concerns. Like I said, every fibromyalgia patient is different. Every fibromyalgia patient has a different story, different areas that they hurt. Some of them have some very similar types of symptoms, but we want to understand everything about your concerns, what you've been through, which doctors you've been to, what are you doing to help your problem, what's worked, what hasn't worked. And then we'll let you know if we think you should go on to step 2, which is a neurological examination, and we'll do advanced eye movement testing. And then step 3, we'll report our findings. We'll go over anything that we found in the exam. We'll look at any of your blood work. We'll let you know if we need to do any special testing. And we'll let you know if we accept your case or not. If we don't accept your case, we'll refer you to whoever we think will be best help you. If we accept your case, at that point, we'll go over our treatment plan and let you know what we think is going to be best for your individual set of concerns. Not every fibromyalgia patient needs every portion of our care. We have to find out what you need because every fibromyalgia patient is completely, really different. There are some similarities, but for the most part, most of them are different. So that's it. I do appreciate you taking the time to watch this video. Again, either Dr. Durr or myself will be in, and we will sit down and talk with you in just a little bit. Thanks for coming into our office and for listening to this video. Thank you very much.
All right, my name's Jamie. I'm here with the patient, Christina Mariani. Hi, Christina.
Hi, Jamie.
All right, Christina has been in our neurometabolic program. So, Christina, what health complaints did you have prior to coming in the office?
Well, I primarily came here for fibromyalgia, though I was diagnosed with psoriatic arthritis several years ago, which is similar to rheumatoid arthritis, and also have numerous herniated discs in my spine.
Okay. So how long were you suffering with these symptoms?
8 to 10 years.
Okay. And how were they affecting your life?
It actually affected every part of my life, as far as fatigue and pain and stiffness and difficulty moving and doing any of the activities I had done previously in life.
So since having care with Dr. Childs and Dr. Durr, what has improved?
Actually, everything has improved. My entire life has improved because just weeks after I started treatment, most of the pain resolved. And I really was able to resume normal activities in life and do all the things I had done before that I haven't done in 8 to 10 years. So it's been a huge impact on my life and has changed it dramatically and brought so much more happiness back to me. So it's been, an excellent program.
Wonderful. And so any other thoughts on your experience at the office, the doctors or the staff?
Well, I really just can't thank anyone enough for for bringing my life back to me. Everybody has been helpful, informative. I've learned so much here about a lot of things in life as far as treatment and how you approach things and nutrition and just movement in general. And the staff has been very helpful along with Drs. Child and Durr.
Okay, thank you so much.
You're welcome.
Okay, so I'm here today with Dolly Rossfelder. She's a thyroid patient of ours. How are you today, Dolly?
I'm good, thank you.
Great. So what health complaints did you have prior to coming into our office?
Well, when I met Dr. Durr, I had extreme fibromyalgia, degenerative joint disease, and asthmatic bronchitis.
Okay. And how long had you suffered with these?
Well, over the years, I probably had fibromyalgia for 30-some years. Mm-hmm. And the asthmatic bronchitis was the last 10 years, and the degenerative joint disease was over the last 10, 15 years.
Mm-hmm. So what did all of these symptoms, including the thyroid symptoms, what did they affect the most in your life?
Oh, my quality of life was getting so bad, and I actually was in bed about a week every couple of months with the fibromyalgia, and nothing was helping. Drugs were not helping. Exercise was not helping. There was nothing there for me anymore except for larger amounts of painkillers.
So, since having care with Dr. Childs and Dr. Durr, what has improved?
Everything. I have never felt this good in years, and I have to say the fibromyalgia is, when I do have a little bit of it, it's certainly doable. I have a lot more energy. I haven't had a bout in bed since I started with Dr. Durr, and my bonus was I lost 25 pounds.
Oh, that's great.
And I'm sleeping a lot better.
Excellent. So, how is all that impacting your life?
Well, I'm not depressed, which I was there, and I also am able to do the things I used to do. And participate more in the kind of work that I like to do, volunteer work, and overall I'm a much happier person.
Excellent. So, any other thoughts on your experience at the office, on the doctors or the staff?
Well, I thought Dr. Durr was very supportive. He even let me email him when I had a question or a problem or just needed to talk. And there was no pressure in the office. Everyone was very kind and very helpful.
Excellent. Thanks so much, Dolly.
Good morning.
Good morning. My name is Dale McGill.
Dale, can you tell me what health complaints you had prior to coming to the office?
I had 2 herniated discs in my neck. About 12 years ago, I had a cervical fusion, and the discs above and below herniated after that. So, despite physical therapy for many years, I was losing the use of my arms.
And how long were you suffering with that?
For about 5 years.
How did that affect you in your life?
It meant that I had to be very careful playing with my grandchildren. When it got worse, I had trouble driving, and anything around the house like vacuuming, even lifting the wash out of the dryer, I couldn't do. And I had to give up doing my hobbies that involved using my arms.
Now, since having care with Dr. Childs and Dr. Durr, what has improved?
All those symptoms are gone. I would say within 6 weeks, I had noticeably less pain in my neck and my arms. And after about 2 months, I felt no pain at all.
Now, how's that impacting your life?
Well, I'm able to do a little gardening. Driving is no longer a problem. And when I'm playing with my grandchildren, I don't have to say, be careful, I can't do that, I have a bad neck, which is important.
Well, do you have any other thoughts on your experience at the office and the doctors and the staff?
I've always felt this was the best organized and the most friendly office I've ever been in. Right from my very first visit, everybody knew who I was, and everybody gets treated with respect and a lot of care.
Well, thank you very much, Dale, for your kind thoughts.
Thank you.
My name's Anita Bailey.
Good morning, Anita. What health complaints did you have prior to coming to the office?
Well, I've had a number of complaints for the last 10 years. Ongoing back problems for about 30 years, and wrist problems due to waiting tables when I was young. But more recently, about 8 or 9 years ago, I was in an accident and injured my shoulder, my hand, and also had disc problems. And that continued for quite some time. I had shoulder surgery, and then was subsequently in physical therapy for a number of years again. And then I was diagnosed with fibromyalgia about 5 years ago, and everything really came to a head then.
Now, how did all this affect you mostly in your life? I mean, how did it affect your time, your happiness? Did it affect you when you were trying to sleep, being able to move around? How about with your work and your family? How did this impact your life?
Well, after the injuries, I actually went on disability, and I was just unable to do the work that I had done for 30 years. I could no longer lift anything over 10 pounds. I couldn't drive the distances that I needed to drive, and I wasn't sleeping. I was in pain constantly. It was just battling pain was the never-ending event in my life. Just what to do to get through the day and the night.
Got it. Now, since having care with Dr. Childs and Dr. Durer, what has changed?
Well, I'm practically pain-free. Last summer, I was just surviving with pain patches on my back and the stabbing pain that I had all over my body from fibromyalgia that was waking me in the middle of the night, the side effects that I had from drugs that were given to me from the doctor who was seeing me at the time. Just everything took its toll, and by the time I came here, I was in such bad shape. But since then, I'm just doing just about everything. I don't have that stabbing pain anymore. I don't take drugs. I feel like a new person.
So how's that impacting your life?
Oh, my husband's happy. And my children, my grandchildren. I was unable to lift the children. I was unable to get through the day to work. I still work part-time, but I can drive more, and I have my life back.
Excellent. Do you have any other thoughts on your experience at the office, the doctors, and the staff?
Well, I feel like coming here is coming to a place that I can trust. I really, everybody's so caring, and most of all, the doctors and the staff listens to what I have to say, and it means so much to me after going through 10 years of feeling like nobody was hearing me.
Right. Yeah.
I just have complete faith in the doctors.
Great. Well, thank you so much for your thoughts. We appreciate that.